It may sound strange, but researchers have found a way to transform fat removed during liposuction into stem cells. Researchers say the process to make the transformation is much quicker than other methods using skin cells. The new cells can then be redirected to form heart, bone, or brain cells.
That means we got to hang on to our leftovers. Yeah. When I do that lipo, this is good stuff. I mean, we're using it right now. In fact, we're going to show it a little later, taking fat from one part of the body and putting another part of the body as a free graft. We know that works. But we have found that in fat cells, normal fat cells, that there's these pluripotential cells, meaning stem cells that can become, if programmed properly, can become any type of cell in the body. And this is the future of plastic surgery.
Awesome. So even if I wasn't able to save my own stem cells, I'm covered by my love handles.
Someday we're going to be able to take those love handles, Jim, and potentially put them to good use.
Well,
this is different from embryonic stem cells.
So you don't have to use embryonic cells to do that. And also, these would be patient-specific stem cells.
It's your own stem cells.
So that's even better.
The theoretical use would be something like, okay, take some liposuction fat cells, you induce them to become pluripotent stem cells, meaning they can regenerate and develop in any, say, heart tissue. Let's say you have a heart attack, and you inject some of these pluripotent fat cells into your heart muscle, and maybe it grows part of your heart muscle, or part of your liver, part of your kidneys,
spinal cord.
Exactly.
Spinal cord.
So all of the potential uses we talk about for the embryonic stem cells, it'll be the same kind of thing. But technology is not quite there yet. But I'm still hanging on to that fat. It's good stuff.
But I think stem cells are definitely the science.
So if someone gets liposuction, should they freeze their fat?
Well, we do that. For some people, we take fat, freeze it, and then come back and inject it later. But I don't like banking fat.
I guess you can always. It's always there though, right? You can always just go back in.
Fresh is best.
Fresh fat.
Welcome back to the L Word edition of The Doctors. Many women do have a love-hate relationship with our next word on the L list. I'm talking about your legs. Lindsay, also known as Diesel, came to us with a very specific concern about the size and shape of her legs.
Hi doctors, I'm Diesel from Angel City Derby Girls. The one thing I don't like about my legs is how bulky and muscular they are. Is there a procedure that could make them look slimmer?
We have Lindsay here for an on-stage consultation with Dr. Orden. Welcome.
How are you, Lindsay? Good to see you. Thanks for coming.
Did you see that hip check, by the way?
Did you see the bruises on her legs? I mean, this is the real deal.
So, Lindsay, your legs look really good to us. Why don't you stand up and show us what you don't like about them?
Well,
show us which areas you'd like thinned out.
Starting, the tops and inner thighs, and then the insides of my knees. I'm pretty okay, I think, out here. It's more the inside area.
How about the outer thighs?
Outer thighs and the top part. A little bit of saddlebag.
This is what we do to determine if somebody's a good candidate, for liposuction. A little pinch test. I can differentiate what's her fat from that well-developed muscle that she has underneath. So she would be a good candidate for just a little reduction of fat, knees, inner thighs, outer thighs.
And you have some good before and afters of that procedure.
We do. These are pictures from Dr. Jeffry Schafer. Similar patient, similar body to you, whose legs were muscular. She just wanted a little slimming and refinement of her legs. Again, very muscular legs that you see in that preoperative picture, but using laser-assisted liposuction, which he did to basically reduce the bulk of the whole thigh, knees. Got a very nice result. I have another result. One of my patients that I did in our office, you can say same thing. A woman that was in very good shape, basically pretty nice legs, but she felt she was a little too muscly, full looking. We did liposuction of the inner and outer thighs and the knees in that particular case. And I want to show everybody and Lindsay exactly how this works. We have a little animation. So again, so important, remember, tiny, tiny incisions. This is now very fine instruments that we're using with liposculpture. The difference being it's not just the vacuum, it's also either a laser or an ultrasonic liposuction device that first dissolves the fat, loosens it up, and then it does have the vacuum part to it where we can actually suck out the fat. The great thing about using laser and ultrasound with it is that you also get some skin contraction, and some tightening of the skin, which we didn't get before. Bruising, swelling, numbness, temporary, you could get back to skating anywhere from a week to 10 days, so the recovery is pretty quick.
But one of the things you emphasized before for you, Lindsay, is you said that Lindsay has really strong, powerful, muscular legs.
She does.
This is a personal taste thing, right? In terms of what you're looking for?
Oh, yeah.
Oh yeah, I told her her legs look good to begin with, but if she wants a thinner, more refined look to her legs,
This is an option.
it is an option.
Well, Lindsay, thanks for being here. Thanks, Dr. O.
And good luck to